So my first one would have to be headaches. I experience those on a day-to-day basis, usually in my forehead, kind of going down to my temples, and then behind my eyes a lot of the time. And typically that's on a 4 or 5 out of 10 on a scale from 1 to 10. And then usually if I don't take any sort of medicine like ibuprofen, it usually can get up pretty high, around like a 6 or a 7. And then usually to help with that as well, I use a heating pad, usually on a day-to-day basis, to put like on my forehead and on the side and all of that stuff too. So I've had headaches pretty much as long as I can remember. I feel like they probably started in high school. If I can remember, I feel like they've always just gotten worse over the years, where back in high school I didn't really have them as often or as much, and they weren't as intense. And then once I got into college and then grad school, that's definitely when they intensified. And I feel like it impacts my quality of life quite a bit, just because I am having to take ibuprofen on a day-to-day basis, and feel like I'm always worrying about my headaches, and I can always notice they're there. So I feel like that kind of impacts my concentration and focus, especially when I'm at work. I am a master's level psychologist, so I do therapy with kiddos. And then for my headaches as well, that's something that also just runs in the family. My mom has a lot of migraines and has experienced those since I can remember. And then my sister has headaches, and then she'll occasionally have migraines as well, but they're not as frequent. My second symptom that impacts me the most is my neck pain. So it basically just runs from up here and goes down on both sides. And I've been experiencing that probably for the past 3 or 4 years, really since I started grad school for my master's program. And I would say usually on a day-to-day basis, that's probably around a 4 or a 5, but it can definitely get up to a 6 or a 7 if I don't really do anything to help it, like taking the ibuprofen, which I feel like, especially that once I get a headache, I feel like that also just gives me the neck pain pretty much right away. So I'll use the ibuprofen and then the heating pad as well. I'll oftentimes like heat it up and put it on my head, make it feel a little bit better, heat it up, and then put it on my neck. So it's always kind of going on different spots. Usually not during the work day, but typically like when I get home, just after a long day, it always typically hurts pretty bad. So usually when I get home, it's kind of on from the time I'm done with dinner until I go to bed. Third one is overall just shoulder tightness and somewhat pain. I feel like I'm always very tense in my shoulders. Nothing really helps to alleviate that. I've tried massage and doing like cupping with the massage to really try to release some of the tension in my muscles, and usually that's kind of like a short-term solution. It'll work for a couple of days, and then my body kind of just goes back to being like super tight. That scale from like 0 to 10, I'd probably say it's usually at a 4 or a 5. I feel like with my shoulder pain, I notice it less because I'm just so used to it. And I feel like my norm is just being tense, so it doesn't really bother me as much on a day-to-day basis, but it would be nice to not be tense all the time. And then my last one is anxiety. So I was telling Dr. Raman that I've had anxiety since I was a little girl. I was diagnosed with Generalized Anxiety Disorder when I was around 10 or 11. So that's something I've just had my whole life, but I feel like it still impacts me on a day-to-day basis, especially just feeling this overall like tightness in my chest. And I definitely think the tension in my shoulders is related to my anxiety and just always being kind of, what is the word I'm looking for, just like hyped up all the time. for the anxiety, I would say on a day-to-day basis, it's usually at a 4 or a 5. But it kind of goes like in waves. So sometimes I don't really have a lot of anxiety. It'll be maybe even like a 2 on that scale. So it's also just situational. It depends on what's going on in my life and what I'm worried about. But I do take anxiety medicine on a day-to-day basis for that, just a low dose of anxiety medicine to help that. It does get worse sometimes, and I think that's also situational. So if there's something that I'm really worried about or is really impacting my functioning, I feel like it will kind of get up to a 6 or a 7 if I'm just kind of almost on the verge of having an anxiety attack. So, but that doesn't really happen very often. So. Doing really well overall. I would say compared to where I was at in the beginning, I'm probably about like 90% better compared to when I came in. So the first symptom that I was having was headaches, and they were really like on my forehead and behind my eyes, and then would sort of radiate back into my neck. I would say that symptom is about 80% better. Still get headaches every so often, but they're not as frequent and they're not as severe as they used to be. It's definitely, well, with having the orthotic, it's improved my quality of life for the headaches. Before, I felt like I wasn't able to get as much stuff done as I wanted. I was more tired or having to rest or put like a heat pack on my face for a while before I could get back up and get back into what I was doing before. Yeah, so I mean, before I was getting a lot of the headaches while I was studying for my licensing exam, so obviously that takes a lot of time, and I was having to take breaks a lot for my headaches. But now that I've passed my licensing exam and seeing clients, I'm able to really get through my day without having too much of a headache or any headache at all, and actually really be focused on my clients, which is important. The second symptom I was having was my neck pain, and that was really just radiating towards the back of my neck and sort of kind of going into my shoulders. I would say that one is 90% better with the help of the orthotic, and then also seeing Bob for physical therapy. That's made a really big improvement. And the third symptom that I was having was the shoulder pain, which was kind of contributed to the neck pain as well. It would just radiate back and then kind of down into the middle of my spine. I would say that is 100% better. I'm really not having any sort of symptoms with that anymore, and I feel like with the orthotic and the help of physical therapy, all of my shoulder muscles and my neck muscles have sort of been able to relax a little bit. They were always so tense. My husband would laugh all the time because they were as hard as a rock all the time, but I definitely feel like that has really improved. Yeah, the other thing that I would notice that has changed is my anxiety levels. I feel like with always being tense all the time, I was kind of always in fight or flight mode with those anxiety terms, those psychology terms. But now I really feel like my anxiety has improved, probably 80% better. I would say like a 4 out of 10. I mean, I've always had anxiety, so it's not going to be fully improved, but I definitely have seen an improvement with that. My biggest expectation, like when I came in, was to just have the clicking and popping, and when I first came in, my jaw was actually starting to lock, which hadn't happened before. So I really kind of had the expectation that only that symptom would improve.
Go ahead and close, open big, and close. One more time, and close. I don't know if you can hear that or not. I could feel it. Okay.
I can hear it in my head.
Of course, yeah.
It's really.
Open big, and close. One more time, open big, close. Come from the front, take a look at the mouth, please. Open wide, and close. Open wide, opening straight, yeah, close. No popping.
But now, obviously that symptom has improved as well as a bunch of other stuff. So it's been a nice journey to see all of those things changing. The jaw, I would say, is 100% better. When I was coming in, my jaw was locking occasionally when I ate like super hard or chewy foods. It was cracking, it was popping. I could hear it like grinding on the bones. And now that symptom is completely gone. It did take my jaw a while to actually like the muscles to loosen up. For the longest time, I could tell that the popping and clicking wasn't happening, but it was still a little bit of a struggle for me to open my mouth. And so along with like my neck muscles and my shoulder muscles relaxing, my jaw muscles have also relaxed. So that's also something I'm able to do, is open my mouth all the way without it cracking or hurting or anything like that. Yeah, so toward the end, before I came in, I wasn't really able to eat any hard, like chewy foods, so kind of like steak, like certain candies and stuff like that, like granola bars. I always kind of start my morning with a granola bar most of the time. It's easy to grab, but I wasn't able to eat those things. But now I can do all of that. And I was also having trouble like opening my mouth to eat like taller foods, so burgers, sandwiches, things like that, but I'm now able to do all of that too, so.
Can you show me how big you can open your mouth? Oh man, that's a good Big Mac.
That'll fit, yeah, a Big Mac cheeseburger in there.
I'm Caitlin McGee. I finished treatment with Dr. Raman 3 years ago and struggled a lot with jaw pain, clicking, popping, headaches, neck pain, shoulder pain, all of those different things. And like I said, we're 3 years post-treatment, and I would say all of my symptoms are so much better. I have no more jaw pain, no more clicking or popping, so I would say that's 100% better. I still have an occasional headache, but I would say that's like 95% better. With my neck and my shoulder pain, I would also say that is like 95 to 100% better. So post 3 year update. Yes, lots of changes with the anxiety. I would say my anxiety has gone down a lot since the 3 years ago when I was first here. I would say the occasional stressor, but 95 to 100% better as well.
Yeah, something happened in the meantime. Mom?
Yep, had a baby 4 months ago, and so obviously there's some stress there with that, but otherwise I'm still seeing the long-term benefits of working with Dr. Raman.